Lameen Abdul-Malik, you won a Nobel Peace Prize with IAEA, the International Atomic Energy Agency, the world's central organization for safe, secure, and peaceful nuclear cooperation. And the work you did helped build Zambia's first cancer hospital. Now, most people hear nuclear agency and think weapons inspections. What were you actually doing, and where does healthcare come into it?
Good. Hi, Toby. Good to speak to you after a few years. So within the IAEA, there's about six departments. A lot of people know about the departments what we call safeguards, nuclear energy, nuclear safety, for example, and nuclear applications and technical cooperation. So I worked in technical cooperation. So basically, under the mandate of the IAEA, technical cooperation is responsible for transferring the peaceful use of nuclear sensitive technology for development. So wherever nuclear technology can be transferred in a safe manner, number one, it has to be cost-effective technology, number two. And the third thing is that it has to be proven technology. So it's not research. So it has to be cost-effective, proven technology, and of course, in a safe manner. What that meant in terms of any scientist that has dabbled a lot with nuclear science will know that nuclear science has a lot of applications across the board. Of course, we cared about the energy aspect, which is the highest use of nuclear energy. And of course, we're not talking here about weapons, but the other areas we can use it for, basically food security, managing groundwater resources, of course, in health. Health specifically, you're looking at things like you can manage obesity with nuclear science technology. The one that usually gets a lot of attention is fighting cancer. So for example, if you're looking at treating some cancers through radiation, that is a nuclear technology. If you're looking at diagnosing some diseases and also curing some minor diseases, like, for example, neonatal like hypothyroidism, you can use nuclear medicine for that. You can use nuclear technology also for assessing blood samples, for example, in the most effective way. But the reason why nuclear science technology was used in a principal way is that it was the fastest technology to find out if someone's infected. So fastest way to detect whether someone has TB. And so it's like the gold standard. So you can find out if someone has it, because the problem with some of the infectious diseases, can we find it out as soon as possible? And nuclear technology is quite fast at doing that. And of course, a lot of the work that I did that I enjoyed actually was looking at helping African countries establish their own cancer treatment facilities. Why was that important? Because when you think about diseases in Africa, everyone thinks a lot about the infectious diseases. What I mean by that is things like HIV, malaria, TB. But we already know from statistics that cancer kills as much as those three diseases together. So it's becoming a problem. And by 2030, they predict that 1.4 million people alone, I think about 1.4 million people die from cancer, 1.4 million new cases of cancer in Africa as a whole. That's quite a significant amount of people, obviously. And that's just a statistic that we know about. Of course, someone passes away in the village, you don't know what they died from. And it could be cancer related, for example. So when you're either doing uranium mines, a lot of uranium mines in Africa, people don't get protected, they get cancer. People are working in mines, whether it's copper or cobalt, what we use for our phones, they get infected, their lungs get infected, they get cancer. So as we move into this new age, ironically, and probably into the AI space, people are getting more exposed to technologies that can actually affect their health.
Lameen, you talk about building with people, not for them.
Yeah.
So on a €100 million project, how much of the work is science and money, and how much of it is conversation?
Good question again. So I always say that the issue is really, from my experience, it's not necessarily even about the money. It's about the people first and foremost. What I mean by that is, for example, let's take a simple example, and it sounds simple, but I like cancer project because it's obvious what you're trying to do. Country X has a number of people that are getting killed by cancer. How do we fix it? Now, two issues coming on board here. What kind of cancer those people have? Are you going to import the right technology to cure that type of cancer? So, for example, if someone has cervical cancer, it's different from someone who has lung cancer. Yeah, they're cancers, but there are different types of machinery for treating those type of different cancers. Number one. The second thing as well is that, can the government afford something like that? Because radiotherapy is quite expensive. The third thing you need to deal with is, for example, the government. So whether it's ministers or senior government leaders, whether the president or prime minister, him or herself, Now, why does that matter? Because at the end of the day, we don't live in an ideal world. Obviously, politicians sadly want to get elected. They want to keep on going or get the next election. So you need to manage that relationship about, okay, you have a problem. How can I help you fix that problem? I'm going to still make you look good. Back of the mind, I'm always thinking about that person on the street who can afford to fly to Europe to get cancer treatment. So what is the most optimal way to speak to the people who are going to, the right stakeholders, to make sure that you never forget about your end goal? The first thing is the intention. What is it that you're trying to do at the beginning? Once you get that right, I understand that everybody's on board. Every stakeholder has different agendas. The doctor has an agenda. The patient has an agenda, just want to be cured, spend a long time with their family. The minister has an agenda, and in between there are other different caveats that you need to manage. So the first thing is basically manage that relationship. Once that's done, the idea is to get the funding and the planning in place. At the IAEA, we had something, for example, someone to build a cancer hospital, because so much work has been done. It's been called the Blue Book. So country X says, we want to establish a cancer treatment hospital. What do we need to do? We had a book. We're going to help you plan a project from A to Z. It might take 6, 8 years to plan that project. This is how we can help your country begin to treat cancer. And the people are the most important. So most projects at the IAEA, it's the corporation, we try and have a slight bias of percent, at least 60% of human resources training. So it's not just about the equipment. You can have the nicest equipment, but if nobody knows how to use it, and you don't also build a sustainable model by keeping people trained and up to date with the technology, then you're going to fail on your end goal, which is actually to treat patients. So we try to help that country build a training facility within the country to treat the key disciplines, like, for example, oncology, medical physics, radiotherapy technicians, oncology nurses as well. So at least that country has a pipeline for the next 10, 15, 20, 30 years for having the right skill set in the country.
So Zambia had no cancer hospital.
No.
So walk me through the room, or when you joined the room, where that started, and who, because you just talked about the different people with their different agendas.
Yeah.
Who has to be convinced, and what do you say in those moments where they're making the decision whether to build or not to build?
So I came to that conversation when that $5.4 million had just been secured. And that's just the beginning. So from that 5.4 million, okay, well, how are we going to manage this process to help you build a facility, buy the equipment? And what the IAEA did, I was at the beginning of that conversation in terms of IAEA had a project, which in the end costed about $700,000 over 5 or 6 years. Was okay, we're going to secure this money, 5.4 million, for the construction and the purchase of the equipment. The IAEA is going to come in and help you manage the process. I'm going to allocate funding to train the key essential staff for the facility. So we said we'll take over the human resources. So, for example, we manage the training of the 4 oncologists and the 2 key medical physicists, and also some radiotherapy technicians and some oncology nurses. So the 4 key areas of treating cancer in terms of mission medicine specialists. And then sometimes it might seem that easy, but then it's not always that easy. So that meant every year, once or twice, going back to the country, meeting the senior decision makers and saying, this is the product, this is what we're doing. And the different factors that come on board. So I'll give you two key bottlenecks that happened. One bottleneck that happened was when building the facility. So because of radiation, you need to build basically almost like a foundation with a skyscraper, because the walls have to be like, I think, 6 feet thick. Now you might think, oh, that's not a problem, but Zambia had never built a building. There was no building in Zambia that was 6 feet thick. So there was nobody in Zambia that knew how to manage even pouring the cement. We actually found an civil engineer that was based in Dubai. So we flew him there to work with the contractors at that particular point to understand that this is how you pour concrete. So if you don't pour it at the right time, it can crack. It's very complicated. The second bottle point that we had, I'm not going to name any names, but when the doctors were trained, you had senior government officials in the ministry that said, okay, they've come back, but we don't have a specialism for these people in our country. We don't have a specialism for oncologists. But we said to them, yeah, you need to find a solution for this, because you can't say they can go for 4 years and come back at the same level as doctors. And of course, one of the things we said to them is that we've already invested $5.4 million from a donor agency. IAEA's invested about $700,000, and I think Zambian government also allocated $2 million for some other bits of the project. So altogether, it's like a $10 million project. Are you willing to throw away 10 million because you don't want someone to be paid an extra, I don't know, $1,000 a year or something like that? We had a very difficult conversation because then egos start to come into play here, right? It's like, oh, I can adopt it, and as much as me, I am the best. Actually, I'm the most in the ministry.
Do you like to invest £100 or $100, or would you like to waste 98?
Exactly.
Right. Yeah.
I was thinking like an economist. I was like, but let's think about it, because these foreign colleges that were trained, there's international level training. There's no such thing as, oh, substandard. They can call a hospital in London or New York and say, do you want an oncologist? And they'll be like, yes, because in Europe and the Western part of the world, there's actually a shortage of staff. So they're always willing to hire people, and they'll get paid 10 times more than we ever get paid, for example, in Africa, right? So I said to them, these guys can get jobs anywhere they want in the world. You're just lucky they're very patriotic. They want to come back to the country and they want to cure people of cancer. So I said, so we had this big tug of war. I said, okay, give them extra accommodation, give them a driver, a car just to help them, give them some education grant for their kids. Nothing to me doesn't make any sense. So we had there was a lot of politicking on that. It took like 18 months for that issue to be resolved, and it got resolved, thank God. So you should do the different things you need to play around with as well. So sometimes you think, but they're going to cure people of cancer. But then someone's thinking, yeah, but that person can't get paid more than me. I'm the man. Unbelievable, yeah. But believable,
but also very believable and very human, right? So
exactly, yeah.
A hospital is the biggest version of what my clients run.
Yeah.
Where do healthcare leaders everywhere get it wrong when they're trying to build something new?
I think one of the things that I've learned along the way was when it comes to things like equipment. What you find a lot is a lot of this very high-end equipment require you to put down at least 10% maintenance costs. Now, a lot of hospitals, primarily in Africa, they will allocate money to buy the equipment, but they will not allocate money for maintaining the equipment. And these equipment are very high, sophisticated, so they can break down. For example, I managed a project in Sudan with the same cancer equipment, and it's a very dusty place. So if there's a sandstorm, which happens every summer, the equipment would just shut down. And also this equipment has to have constant electricity. So you can't have a power cut, or you have to have a generator that kicks in literally within 30 seconds. And this equipment, if you pay more for it to be down. So let's say there's a power cut, and power cut lasts an hour. The equipment is not going to work for the next 5 or 6 months because of that. So we just explain to them, hey, you want to have this sophisticated equipment, but this is nice. Have you got money for maintenance? Number one. Have you got money for a high-end generator that basically kicks in as soon as the power cut comes in? Like we're talking about, kicks in within like under 1 minute. If not, this $4 million investment you've put in, sadly, it's not going to work. But most importantly, cancer patients are going to die because cancer patients have to be seen every day. These cancer hospitals in Africa, and some of them, I have to commend them, they have 2 shifts. So they will work almost 24 hours a day because there's so many people that have cancer, but then they have like 8-hour shifts. Like every 8 hours, there's someone basically treating someone. So imagine it being down for 3 or 4 months. A lot of people are going to die because they need to have their treatment. They call them fractions. You have like 10 fractions, for example, like that. So you have to come like every week for half an hour and get your treatment. So I say this is the most important thing that we need to focus on. It's not about buying the equipment, but also making sure that we can maintain it, and you have constant electricity to maintain that you don't stop treating patients. And this is the concept of a maintenance culture, which is something a little bit difficult. I found that a lot in Africa. Again, I don't know what it's like in Europe, but I found that some of my other colleagues said, no, we don't have those issues in Europe, but they said they had other issues in Europe. I think more office politics.
Yeah, there are different issues everywhere, but what I'm sure is a really valid point across, even if it's a small practice, just investing in their first piece of equipment or whatever it is, or people, actually. What I'm hearing is What sort of contingency do you have? It's
Yeah.
contingency, isn't it? That's
Yeah,
what it is.
exactly.
Where's the backup generator? What happens if it goes down? What equipment can we use if your hero equipment isn't working? Equally, especially with new or entry level staff, sometimes it's worth investing in two, not one,
Yeah.
because one may leave.
Yeah.
I've got a challenge for you because I know you're working really hard on putting impact your framework. Everyone loves a system. Everyone loves a framework. Um, Everyone's got an acronym hidden somewhere in a bio. I love it. Give me challenge. Give me your impact framework in 60 seconds.
Impact framework stands for intention, mastery, planning, action, connection, transformation. So I stands for the intention. What are you trying to achieve and why? M, mastery. You have to understand you don't have all the skills. So what skill sets do you need? Soft skills and hard skills as well, basically to build on your intention. Next thing is you've got to plan. You want to plan properly. Plan, learn from other people. Not saying the plan is always going to be perfect, but at least you need to have in your mind a set of rules and financials about how this is going to take place. Next thing, you've got to take action. You can't wait in inertia saying, oh, I need the perfect plan. You've got to take action. In fact, when you take action is where you actually learn. C is connection. Who are you actually trying to have an impact with? Again, in healthcare, it's basically the patients. You need to connect with them. If you get everything right, you're working with the end users, which is basically what we call the patients in healthcare. You understand their problems, then you can actually end up with T, which is transformation, transforming people's lives, transforming communities. For example, in cancer in Africa, the high incidence is actually with women. So it's basically with breast and cervical cancer. And in those communities, the women are basically the backbone of communities. So if the woman dies, that's basically the end of the children's development in terms of going to school because the father's out the whole time earning. So those kids are basically by themselves in that community and they basically have to give up on going to school. So the idea is looking at whose lives are you trying to transform. So that's the T and try to do it fast in the 60 seconds.
I think you've provided the perfect social media clip for that. Let's make it relevant to my clients, right? A consultant with a private clinic, maybe two staff, full diary, because their specialism is in demand. No real strategy other than trained, great expert.
Yeah.
Things are getting busier, but now things are busting at the seams. There's no contingency in place. Walk that client through the 6 dimensions and how it applies to them.
Okay. So you said mentioned basically before they only have 2 staff.
Yeah, small support staff. Yeah.
So I think going back to looking at the mission statement, the intention at the beginning. So sometimes I talk about the concept of ikigai, but in this situation, it's not about the individual. But let's say, okay, what is it that this institution was set up for initially? Can we revisit that? And does that still hold true? Is it still valid? If it's not still valid, we need to go back to the drawing board and start again. Because even from the intention, the I and the impact framework, we need to look at who are we trying to connect with and whose lives are we trying to transform, and it circles all the way back. So we say, okay, if it's true, we accept the mission statement. Let's go on. Do we have enough staff, or do we have the staff with the right skills to basically deliver on the mission? Now, sometimes what I found in my experience is that sometimes, let me give you classic examples. I mentioned that IAEA, we're transferring technology in a safe way. So I found in some organizations that people would just promote the people who had the most qualifications. So someone had the PhD, oh yeah, they're going to be CEO or director of a department. Whereas when you're dealing with something that's very critical for the safety of people, it's not about if someone knows the most, it's about do they have the right character trait. So for example, one real example, we advise a country that needs to close a mine because the mine was violating safety rules. I said, who's going to go and see this person? And I said, oh, it's this lady. She's the most competent. She's got a master. I said, it's not going to work. You can't go to a mine and say, can you please close the mine? No, you've got to take someone, even though they're less trained, but has the forceful voice and says, if you don't shut this mine down now, I'm coming tomorrow with the police and you're going to be fined $1 million. Who do you think they're going to listen to? The person that threatens them, even though there might be a whole threat, but at least they're going to sit back. So in terms of mastery, Even if the person says, okay, we're not going to hire any more people, this is what I have. Okay, let's look at the people's skills and who has the best skills in that particular area and who should we move around a little bit. For example, when I had my coffee shop, I hired people that I made sure everybody knew how to make coffee in the coffee shop. So if someone was sick, someone could step in. But it didn't mean that everybody was making coffee every day. The best barista was making coffee every single day in the coffee shop. But then if she was sick or she had to go to the bathroom and have a break, can't stop selling coffee, someone else will step in and take over that role. And of course, I had overall impact in that role. So for example, going back to your example, one of the things I talked about leadership is that leaders should have some kind of overall understanding of everybody's job to know how they can step in. So pick up the slack. So I think evaluation of the skill set in the organization, if they're not going to hire other people, and perhaps someone might even love doing something else they're not even doing, and they'll put more effort into that. So that's the second thing.
It's a great strategy to give people new roles within an organization because it regenerates their enthusiasm and they stay. People don't just stay for money, they stay for feeling.
So the next thing we need to do is look at the planning. So do we have the right planning tools in place to deliver on the mission statement? For example, I used to use something called the results-based management system. It gives the concept of log frames. So you say, okay, this is the outcome we want, and you plan backwards. So if you want an outcome to treat, again, I'm going to go back to the cancer because it's very easy. If you want to treat 5,000 people a year, what is the output that we need? We need to make sure that we have the output of things that are tangible. We need to have a record of a target, a KPI for how many people we need to treat. And then we need to create activities. We need to make sure that our doctors and staff are constantly trained. And then the inputs are basically what we call the financials. So you say, this is the outcome we want, and we climb backwards. So for example, in this health practice, how do we want to reach our mission? How do we want to achieve our mission? It must be some kind of quantitative or quantitative KPI. I always believe that you need to have some kind of target. So it just drives you in a way where you're trying to get, and then you need to plan back about how you're going to get to those targets. And you need to also be realistic, because sometimes what a lot of governments do is that they want to have this fantastic outcome, but they don't want to, you can't do that unless you increase the workforce by 100%. So no, let's break it down into biteable chunks. So if you want to reach the target 100%, if we can't do it this year, let's have a 3-year phase. This year we do 30%. Next year we go for 50 or 60%. Then let's see if we can get 90 to 100%. So the goals have to be smart, specific, measurable, achievable, reliable, and timely. So you want to set realistic targets. The next thing, you've got to take action, because when you take the action on the plan, then the plan becomes real, right? So because all the things you plan in your head, when you take action, oh, actually, this is not working. Actually, I prefer to do this instead. I think we're going to the wrong market. We're getting more response from this group of clientele or from this client base than from the other base. How can we adjust to that? So you have to bring a bit of flexibility into it. Even though you're not happy, how would you change it? What would make you want to come back? How can we improve? So you connect with the people you're actually trying to serve. And hopefully when you bring everybody on board, you're able to transform the organization, also your clients or customers' lives as well, for the better.
When I'm thinking about my clients, they're almost traumatized by the level of training they've had. The surgeons especially have had so much training. That dream is like, I'm going to have my own practice one day, and I'm going to help people because that's what I've trained to do, and I'm going to have my own practice. And then they get to a certain level where they have their own practice, and then suddenly what was the dream has been achieved, and then it's what's next. And then it's basically, to your point, I can't remember who said this, but I love the quote, maybe Marshall Goldsmith, what got you here won't get you there. So then you revisit the impacts. Well, now you've achieved this, and you're in your 40s, you're on the edge of burnout. It's the goal you wanted when you were in your 20s, but now what? And how do you do that? Okay, you're in business, so it needs to be profitable, but it also needs to not cost you your sanity and your physical health in your own life, which is where we lead to less effective doctors, which means we lead to potentially some dangerous decision making based on the fact that people have less energy. In Instagram business talk, we're talking about a rebrand.
So that's why, in my book, the intention part at the beginning of the impact framework is also I go through an exercise of the Ikigai, right?
Yeah. Great.
To look at building a purposeful legacy-based business. And that means that, okay, ideally, that whatever business you're doing, whether it's a doctor doing their own practice, that you're not thinking about, oh, this is only about me. You're thinking about the clients and the legacy you're trying to build, so that you have to, a particular time you realize you're burning out, okay, I need to hand the reins off to someone else so that we're still focused on the delivery of what my dream was. Not get too attached to say, mine. It's like, when we're raising kids, sooner or later they've got to leave the home, right? And one of the things that you praise it as a parent is that you've given them the skill sets, whether it's, the university is good and everything, but also just to interact in a positive manner with society, that whoever they go with, or whoever they marry or they interact with, they're nice to them and they're kind. So you can't be there all the time. It's impossible, but you just do your bit for the first 10, 15 years or 18 years or whatever. Then you've got to let go. And I think sometimes people in business, they try and hold on to everything forever. Perhaps it's time for someone to take over the business, but you can still be detached from it. But at least you're still focused on the initial dream. Maybe someone else is just taking over the dream for now, but it can't be your dream forever.
Yeah. And it's okay to change your mind is a good one as well.
Yeah,
These things
exactly.
and just like you went from doing Nobel Peace Prize winning cancer hospital building to a coffee shop. Unbelievable. Tell me about measurements.
Yeah.
Because I know that clinicians love to measure these clinical outcomes really obsessively. Yeah. But then there are things they don't measure.
Yeah.
What might those be that would be useful to them?
Yeah, I mean, I'm guessing you're talking about business or organization measurement and also personal measurements.
Every business problem is a personal problem in disguise.
Yeah. Again, I was using a lot of what we call the results-based management framework, the law frame, and KPIs are built into. And one of the things is that even when I started in the UN, the IAEA, back then, the UN used to focus on not what we call outputs. So we spent $20 million training 300 people. Great, done. But we found out that's not actually creating an impact, because impact is behavioral change and it's much more difficult to measure. And in fact, that's one of the biggest challenges when I was working with governments, even within my organization, because it's very easy to look at the outputs and say, yes, we spent this. Yes, we trained this. Because outputs are basically what we call things that are tangible, things you can hold in your hand and you can see. But it does not create impact, because impact is the behavioral change, which can sometimes take 5 to 10 years to measure. Now, in the concept of, again, coming back to my cancer example, the output might be like, yes, we treated 500 patients this year. And in Zambia's case, it was 1,500 patients a year that we're treating. But then you need to look at how we are addressing cancer overall. We need to go back and make sure that people are more aware. So we're not treating more patients, beginning to treat less in the next 15, 20 years. So we need to make sure that people change their behaviors, whether it's to do with nutrition or exercise, for example, so that we're changing people's behavior so they're actually healthier. In hospitals, this is one of the biggest challenges. It's about how many patients do we treat. When I was meeting with ministers, this is the challenge. They don't understand the concept of outcomes and what impact is, because impact is the part where you transform people's lives, where you connect with them and you change their behavior, which is a lot more difficult to do and a lot more difficult to measure. So when we used to design projects, when you design a product, you have something called risk and assumptions. So for example, a risk and assumption is that when you plan the product, you say, okay, if this happens, if we train 20 people and they don't all leave and go to Europe, then they come back, then they treat patients, and then they get a healthier population. So it's like backup. Now the KPI is there at what's inside. So what are you trying to measure that can create a change in people's behaviors? Again, going back to your example about hospitals and practices, it is a little bit more difficult because we want to just look at the figures. Let me give a real life example. One of my ex-colleagues, she used to work one of the top cancer hospitals in the world. And I said to her, why do you want to come to IAEA, which is basically a bureaucratic organization, it's the UN. She's not going to be treating cancer patients. And she said she just got so fed up with basically the penny pushers in the whole organization that, cancer is a very personal thing and patients pay for 1 hour, but then they're being told, just keep it up 15 minutes. After 15 minutes, just tell them, thank you, I've got another appointment. I just felt that this is not, because sometimes some cancer patients only want to talk to their doctor. And as much as important that it is to treat that patient, it's also the psychological aspect which we can't measure yet. Because just spending an hour with someone that has cancer, as opposed to spend 10 minutes and brushing them off, they just think after a while, you really care about my money. I don't want to the next person. And that can affect someone's psychological a lot. We began to find out that no matter how rich you are, very rich people like in Africa, they will go to London or New York to be treated, but they will come back and die. Because when they went out to London or New York, they would probably travel with their wife or maybe one child. But when they were home, they had a whole community around them, like 20 or 30 people, their siblings, extended family come to, and that gave them more hope than just seeing one or two people next to you on the bedside. I think it's something difficult to measure the psychological aspect of it. That's why I think when we look at medicine, we should look at everything holistically, not just focusing on the medicine and the treatment, but looking at also the human psychology and spiritual aspects and mental aspects, the emotional aspects as well. And then we can see, okay, the behavioral change, which is, I admit, is really difficult to measure. People don't like that. And I used to have a lot of arguments, to be honest with you, in my organization about outcome measurement and not just quantity measurement.
I worked with an oncology organization over a year or so, and that was the big one. They wanted to speak to their doctor, and the doctors are really busy, which is why the podcast thing worked really well, because then they were hearing, it was also the moment of diagnosis. I have this conversation all the time because it's my favorite example of the work that I've done, is that speaking to a physician who told me that he sometimes has to diagnose or tell people they have cancer 12 times a day. There's 12 people per day. And that's a heavy gig for anyone. And I say, what happens? He only actually has 15 minutes, maybe half an hour. Then what happens? They go to the care team. The care team hang out with them for half an hour, maybe an hour, maybe if they've got the spouse with them. And then what happens? Well, they walk out the building into a completely new world. And then what happens? Well, he says, what happens is the phone rings a lot because it's the patient saying, oh, I just want to make sure I didn't miss anything. What about this? What about that? And so the whole thing is time cost, and they will only take it from the doctor. They won't take it from the person on the desk. They want my doctor. Where's my doctor? And so when I took the examples of what I learned from Julian Treasure, who's also done an episode of this podcast, he talks about listening positions, and the listening position of somebody who's just found out they've got cancer is different to the listening position of someone who found out 3 months ago, and is different to the listening position of their spouse, and is completely different to the listening position of their 12-year-old child. So we make assets, we make podcasts that speak into the listening of a child in that moment.
Oh, wow.
This isn't about somebody who sounds like me, because we know doctors travel everywhere and they're from all corners of the globe, but they are in my community. They live in my town. Their kids go to the same football club. I'm listening to somebody who is my doctor, or is my friend's doctor, or is my mother's doctor, and I know that they drive the same roads as me every day, and they shop in the same supermarket, all of that kind of stuff. And that matters to people. And this is why people go home, even the rich ones. Like you said, they go to New York, but they want to return home in some way. So that's the way that I've been helping these people create more impact, connecting with them at appropriate moments without burning them out, and just saying, right, let's start with the top 5 cancers you treat. What stage are they at? Who are these people? What age are they? Do they tend to have families? And hopefully what also happens to the patient is they're not re-traumatizing themselves every time somebody says, what have you got and how bad is it? And
Yeah.
also, I hope what the podcasts are answering as well is how these people can support and help in and around the community.
Yeah.
Let's talk about the fact you've written about coffee for 18 years. And I wonder why. I know why you've done that, because you love coffee. But what has showing up for 18 years done for you in a way that, a credential or what have you wouldn't have taught you? What has the repetition and the practice of your obsession with coffee taught you?
I'm liking these questions. I thought a lot about this because when I was writing, in fact, when I wrote The Impact for It initially, it was actually supposed to be a book about how to create a coffee business. And that's why it built up from that. So there's a lot of stuff about my own personal journey with coffee actually in the book. And one of the things I always talked about is that whatever you're passionate about, and sometimes that word is in fashion, they're not in fashion, I think it's always good to reconnect with it on a daily, weekly basis at the most. I think that from when I was as young as I can remember, I always loved the concept of taste. I love cakes, I love food. And then coffee was a new channel for me. And I thought, okay, I need to connect with this on a daily basis. So I think it was like a passion that I want to just make sure that keeps me kind of, I don't want to say grounded, but it's like just connecting with something.
Though. It's a good pun.
That's true. Just reconnecting with something that you're passionate about or that just kind of brings you a bit of joy. But even in the concept of ikigai, everybody talks about, what you love, what the world needs, what you should be paid for. But also if you look at the concept behind ikigai, there's also 5 concepts about engaging with what you love on a daily basis. For some people, it could just be painting. Maybe they take the 6 months to do a picture, but every day they're painting something, they're connecting with. Some people, that's coffee, like me. Some people in Japan, the concept comes from Japan, is basically like either learn how to make sushi, but they're connected with something that brings a lot of joy to them on a daily basis, and that keeps that light burning in your heart. And I think with the 18 years, I've never seen it as like a burden. It's just something that comes naturally to me. And I think when you do things in a consistent manner, it becomes part of you and who you are. So when we have conversations, people say, oh yeah, Lameen's passionate about coffee. And I've had some really interesting conversations, and I think that even led to some business opportunities, because I thought, I don't want to talk about coffee, but no, I want to learn about coffee because I want to hear, because my grandfather was really into coffee and he created the first coffee shop in Korea and all that kind of stuff. And I was talking about something completely different, but it connects all different areas. So I think just 18 years, just being consistent, it becomes part of you. And I think sometimes what happens in life is that people are very passionate about certain things in life, but they say, no, it's not important. And they kind of keep it down. And then 20 or 30 years, like, you know what? I really love baking. I really love painting. I really love pottery. I really love woodwork, but I never got the chance to do it because I just thought it was a waste of time and no one's going to be connected with that. But I think that's what makes everybody in the world unique. Everybody has this unique thing that they love doing. And I think to be true to yourself, you should really find that joy within yourself and to just reignite that love for it as often as you can. Yeah.
Yeah. If you have a business of any description, you're taking a risk, right? Because you're not getting a job. You're betting on yourself.
Yeah.
It also gives you permission to choose the people you work with. And if you're interested in art, even if you're an oncologist or a plastic surgeon or what have you, my belief is that you talk about that somewhere in your messaging, somewhere in your about page of your website, somewhere in your, because what happens, and it happens with me as well, my background is music, and music is a great deal to me. What I find, unsurprisingly, is that most of my clients hold value and hold music in very high regard. It's valuable to them spiritually and emotionally. And it might not be anything to do with their business.
Yeah.
But because of that, and because of the way that it comes out, because people want to know who they're dealing with.
Yeah.
So if you're an oncologist who's into art or coffee or whatever, and you talk about it, you're going to attract the kind of patients that you want to be around and you want to help, more than just the generic leading with your credentials. So I love that you took the turn into coffee and cake and all of that stuff, and that you're proactively talking about it in a way that people lean in. They're like, what? This guy did that now. But it's part of now, it's so easy to talk about you to people because you're not, there are a million award-winning such and such. There are loads of Nobel Peace Prize, not too many, but there are some. There's a big building I've stood in front of in Oslo, but there's only one who did that thing in Zambia and then built a coffee business.
Yeah.
So you want to impact 1 billion people by 2032. My listeners have patient lists of thousands, some of them hundreds. What's their part in that number?
People always ask me, oh, how are you going to impact 1 billion people by 2032? And I said to them, the most important thing is just the journey and also inspiring people. So I've got people that have come to me and said, oh, I really love this message. And I always think about this message. In fact, someone I know tries to direct their investments through things that can have an impact on a lot more people. So the thing is that getting the messaging out, and I say if you inspire 1,000 people and impact 1 million people, that's 1 billion people already. So it's not about me personally doing that. It's about maybe inspiring other people to also be part of that journey, because it's not something that I can do by myself. There's 8+ billion people on the planet, and just getting that right messaging out, because there's so many different messages across the world. Some of them are not pleasant at all. But I just think that if you just keep on dropping off positive messaging across the world, it kind of reverberates, then that will be fine. No, the idea is that just keep on getting that messaging out. And perhaps something will land on my desk one of these days, or someone will come back to me and say, listen to your message. I've created this product that's going to show 1 billion people of this. For me, that's success, right? It's not me personally doing it. It's just inspiring other people to be part of that journey.
So there's no box with 1 billion empty boxes. Yeah.
No.
It's also a noble goal to talk about. I've had this conversation twice already today, versions of this, where people have this large, noble goal.
Yeah.
And it's amazing, but there's no plan and there's no contingency. This is what's amazing about what you've already achieved is that you are talking about planning it, and you are talking about taking action, and you're talking about learning from the actions and just momentum.
Yeah.
Clearly you accept that 1 billion is impossible to measure.
Yeah.
But also it's completely doable, and you could achieve it, and you could never know that you achieved it because people don't communicate, oh, it was that. But it's the ripple effect. And if I said something that I learned from you about impact, and then I said to someone something and they did it, and then they got your name, it's still an impact. It's still that. So I love that, man. Let's talk about what you're working on next and the Nobel Peace Prize entrepreneur.
Okay.
Close out.
Yeah. So I mentioned to you initially, I thought about sharing more of what I've experienced in my life. And initially I wanted to just write a book about how to create a coffee business. Again, based on the concept of being a purposeful business. What I mean by that is creating a business that aligned with how you want to show up in the world after a lot of self-awareness. I believe that's a business that's a lot more sustainable. Doesn't mean you're going to become a millionaire or a billionaire, but at least you know that every day when you're doing that business, it's part of your DNA, your generic self. So actually, I wrote it initially as a course for a university, because they said, oh, can you design a course for our students on entrepreneurship? So I thought, okay, the only journey I can talk about is when I created my first coffee shop 16 years ago now. So I went through that whole process, and I've tried to break it into chapters. And then someone introduced me to a vision coach earlier on this year. And he said to me, he said, what are you working on? I said, I'm working on this book, entrepreneurship mindset. And he said to me, can I be honest with you? I said, please give me advice. You're a vision coach. I said, first of all, you've neglected a big chunk of your life. You're only talking about coffee, but you haven't talked about what you did at the UN or the British government. What are the lessons? Because that would have a wider reach. So you're not just talking about your business, you're talking about what you did, what is, and that is as Cancer Hospital or other projects that I work with. So I advise to rewrite the book and bring in your whole 25+ experience into the book. So you've got to think about tides. And it reminded me of what Napoleon Hill said in his book, Think and Grow Rich, which is a fantastic book. And there's a chapter in there, he says, people don't buy books, they buy titles. And that's why I called this book Think and Grow Rich, because he just said how to be a better person. No one bought the book. And in fact, if you read the book, it's human psychology, all the 13 rules about human psychology. He said to me, think about a title that nobody else in the world can think of, right? And he said, think about Nobel Peace Prize, and added something, maybe entrepreneur, something like that. I said, no one else can say that. So I went back after him, went back to the drawing board. I thought about a framework. And even in my entrepreneurship mindset book, I talked about having the right intention, getting the right skills. It was my journey. I said, okay, yeah, I want to have a coffee shop, but if I'm going to have a coffee shop, I want to be a guru in coffee. So I need to learn everything about coffee. So I spent 5, 6 years going to conferences, reading books. That was the mastery aspect of it. So go to countries, plan project, implement projects. So that's basically the plan and the action part. The connection part came a little bit from my coffee shop, because when I'm at a coffee shop every day, people will come and see me, talk to me, take pictures of me. I was connecting with my community. So people came to the coffee shop because of me, because they wanted to meet a Nobel Peace Prize laureate, for example. And the transformation was basically going back to the UN aspect about how did I transform people's lives in my projects? Not so much in the coffee community aspect, more on the UN aspect. And that was the birth of basically the impact framework. So the book, in essence, is basically like a semi-autobiography, all about impact framework, about different aspects of my life under the IMPACT. So real life examples from working the UN, lessons that I learned from that, secrets from that I can share with people. And the idea behind the book is basically just if people want to build a legacy business, or young entrepreneur does not believe in themselves, because the most important part of the book for me is the intention part, having the right mindset. Actually, if you don't have the right mindset, if you think you're going to fail, then there's no point trying. If you think it's going to be horrible outside, it's going to be a war outside, you're going to get out of bed. But if you have the right mindset, okay, what can I do? I really believe in myself. This is what I want to do. That's the impact. That's the intention part at the beginning of the book that should be checked across all 6 variables, actually.